Hello, Dr. Warwick and classmates. This is Lynn again, and for this week, I would like to present to you an ethical issue to post-NIPT. As I pointed out in the previous presentation, a child is a gift from God. All parents want the best reassurance for their pregnancy and to protect their unborn to the greatest capabilities. But for many parents to be, genetic testing can offer peace of mind, while for others, it can bring more worries. Just a few decades ago, the only way to detect genetic disorders was to have the pregnant woman undergo an amniocentesis or chorionic villus sampling, an invasive procedure that can put the fetus and the mother at risk. Today, there's a variety of screening tests that measure risk for genetic disorders, known as a cell-free or non-invasive prenatal testing, NIPT. This test measures fragments of genetic material of the mother and the baby through the mother's blood and is intended to detect Down syndrome and a few other chromosomal conditions at 10 weeks of pregnancy or later. You may have heard these tests called by their brand names also: Harmony, Maternit 21, Panorama, and VeraV. Results are usually available in 1 to 2 weeks. What seemingly differentiates NIPT recently from other prenatal tests is the perceived inference that it's diagnostic in nature, providing conclusive results equivalent to that of invasive procedures with just the ease of obtaining a vial of maternal blood. This, in fact, is not the case. NIPT is a screening test that has been found to be 92 to 99% accurate in detecting these conditions. These tests claims that they allow women to find out whether their baby has one of the conditions without subjecting themselves to an invasive procedure such as the amniocentesis. While there are benefits to this non-invasive testing, there are also limitations. Some of the disadvantages include the value of the child with a disability is being degraded. The pregnancy can be terminated if mother does not like the result of testing. The woman may look at her child with the disability and think it is not perfect. Genetic screenings can give false positive results, meaning they can be wrong and lead expectant mothers to believe their unborn babies might have genetic abnormalities when they do not. There's also a chance that the screening will not pick up a chromosomal abnormality when there is one. That is why pregnant women should not be making decisions about terminating a pregnancy based on a positive screening results alone without getting an invasive diagnostic test to confirm or rule out a diagnosis. Another downside is that NIPT is very expensive, thereby cannot be attempted by people with meager means. Only a handful of insurance companies are ready to cover the expenses of these tests, which cost anywhere from $500 to $2,000. This leaves couples with limited or no choice at all, so most wind up paying out of pocket. Those against genetic testing feel that the biggest disadvantage of prenatal testing is the tremendous psychological pressure imposed on the parents. They are in constant anxiety about the possible results. If the screening yields positive results, then the couple will have to deal with these new information and choose whether or not to act on it. They may follow up by seeking out genetic counseling and undergoing prenatal diagnostic tests to more accurately detect whether the fetus actually has a genetic condition. Ethical considerations. While not all prenatal testing is performed for the sake of abortion, the vast majorities are. This has resulted in a large decrease in the birth incidence of Down syndrome in the United States, and selective abortions for congenital abnormalities are increasing worldwide. Over 90% of women choose to abort a baby that has been diagnosed with Down syndrome. Parents decide whether or not they will allow their child to live, makes a statement that those with disability or illness do not have the right to live. Who are we to decide that one life is not as valuable as another? In summary, like other prenatal testing, non-invasive prenatal test screening can become an ethical issue. Not only that there is always a chance that the results are wrong, creating false expectations, needless worries, it causes harm when it allows parents to design their ideal child, testing for traits such as sex and eye color, and abort any children that do not fulfill this design. In addition to that, prenatal testing also supports the eugenics movement, a scientific idea that seeks to improve human species by controlling reproduction and eliminating weaker or handicapped human beings. Many of the condition tests for prenatally are not treatable, but the medical problems associated with them are, and the people who have these conditions often live productive and satisfying lives. So why prevent this?